All right, well, good afternoon, everyone, and welcome to the Supporting Client Health and Wellness class presented by the Far Northern Regional Center's clinical team. My name is Jen Badger, and I'm an RN. I work for Far Northern out of the Reading office, and it's my pleasure to introduce Nellie Camarena. She's our RN out of the Chico office.
Hi, welcome, everyone.
Let's see, I didn't see it. Is Christy on? Nope, I don't see it. Okay. She might join later though. Okay, well, I think it's great that you guys are all here, and we'll go ahead and get started. So today we're going to talk about wounds prevention and care part 2. So if you were on the last call, then you know that we kind of ran out of time. It's a pretty big topic. To be honest, I was thinking I could probably do a whole nother training just on like diabetic wounds, or there's just a lot to talk about. But I really wanted to finish up the pressure ulcer discussion that we started last time, and give you guys some tools that might be helpful to prevent those or to help them heal if you have clients who have a pressure injury. So pressure injuries are a really big problem. In the United States, approximately 1 to 3 million people develop pressure ulcers or injuries every year. And more than 2.5 million patients in the US acute care hospitals suffer from pressure ulcers. And about 60,000 people each year die from complications of those pressure ulcers. Pressure ulcers can diminish global quality of life because of pain and management procedures. It can increase the length of hospital stays, and furthermore can contribute to rapid mortality in some patients. In the US, the annual cost of pressure injury management is estimated at $1.6 billion. Did I skip one? Hold on. Sorry, okay. So we saw this slide last time. This is kind of shows what's going on with the tissue in the skin. On the right, you can see, there's the epidermis, that's that outermost layer, the dermis, which has all the blood vessels and things in it. And then the hypodermis is the sub-Q layer. So that's the thin fat layer that's under your skin. And then under that is muscle and then bone. And so what causes a pressure injury is when you have the downward pressure of the individual's weight and then the upward pressure of the seat or mattress that they're on. And you can see it really squishes that spot right there under the pelvic bone. And when it does that, it's cutting off circulation to that area. And that is what causes a wound to develop. So here you can see the common points of pressure for an individual who's laying in bed in various positions. And you can think about like on your own body when you are laying, flat, and where you can feel bones and not a lot of tissue, over those areas, that's usually where pressure ulcers are going to develop. So over the hip bone or the trochanter at the top of the femur, the tailbone or sacral area up at the top of the buttocks, elbows, ribs, even toes, and heels are a very common spot as well. So this picture shows the points of pressure for individuals in a wheelchair. And you can see there's still quite a few spots, right? Even the shoulder blade in the back can form a pressure wound if somebody's sitting in the same spot in their chair or up in the chair too long. So caregivers really should be aware of the points of pressure so they can be sure to check those skin areas on a regular basis. And they can ensure these points are cushioned to help prevent pressure injuries. On this slide, we talk about the direct causes and the indirect causes. I know we went over this briefly last time, but I wanted to just talk a little bit more about friction and shear as direct causes of injury. So friction and shear are mechanical forces that contribute to pressure ulcers. A shear injury isn't typically seen at the skin level because it happens underneath the skin. Think of it as pulling the bones of the pelvis in one direction and the skin in the opposite direction. And the deeper fascia slides downward with the bone, and the superficial fascia remains attached to the dermis. And you're basically like pulling them apart from each other through shear. This damages the blood vessels in the skin and leads to cellular death and tissue necrosis. But unlike a shear injury, friction injury is visible. Friction is the mechanical force exerted when skin is dragged across a coarse surface, such as bed linens. A skin injury caused by friction generally looks kind of like an abrasion or a superficial laceration or skin tear. Friction then combines with shearing forces, and the ultimate outcome of that is a pressure ulcer. Those at risk for pressure ulcers from friction are generally elderly people or people who are immobile, or those who have uncontrolled movements due to neurological conditions. So, maybe they have a significant tremor or, in their arm or their leg, and so it's constantly moving back and forth. That skin is being having that friction on it. It also can be caused when people use braces, not the teeth kind, but like orthotics, AFOs, those kinds of things, when they rub against the skin. So preventing pressure injuries requires these 6 things. If you can assess or implement strategies to address all 6 of these, you should be able to do a pretty good job of keeping someone from getting pressure injuries. Now, that doesn't mean that they absolutely won't. Sometimes conditions such as poor nutrition or moisture on the skin can't be completely resolved, and so those individuals will still be at risk. But if you try to come up with a plan for your folks who are either immobile entirely, maybe they're in bed all the time, or maybe they are utilizing a wheelchair most of the time, if you work on all of these things, hopefully you can prevent that from happening. So regarding risk assessments, at the very least, the Braden scale should be used when a person initially comes into care, and then anytime there's a change in condition. So you can see here, it has on the left side column, sensory perception. So that's, can they feel everything? Are they going to be able to sense pain? Are they going to be able to sense if there's, a big bunched up wrinkle like under their hip, or can they feel it, right? So, you should have a pretty good idea based on individuals' health history if they have issues with numbness or decreased sensation. Anybody who has diabetes is at really high risk of numbness and neuropathy, which makes it very difficult for them to feel, which if they can't feel that it's bothering them, they're not going to necessarily like move on their own to reduce the pressure. So it gives you 4 options, and you would pick whichever one they fall into approximately, and then that's the number you would write over on the right hand side. Then you have moisture, activity, mobility, nutrition, and friction and shear. So when you get the numbers for all of these and add them up, it gives you a number that corresponds to these at the bottom, and you can figure out where that person falls. Now, if their score is more than 18, they're doing good. They're probably not going to develop a pressure ulcer. But as you can see, if they're anywhere under that, you know, they could be at moderate risk, high risk, or even severe or very high risk. And this just alerts you and your staff to, you know, how careful they need to be, how frequently they need to be helping reduce pressure, and also how frequently they need to have their skin looked at. Because if you're not looking at their skin on a regular basis, you're not going to see when this happens until it's probably too late. And by too late, I mean until they've already got a significant ulcer. So this is just one way of doing a risk assessment. And it's probably the best scale out there. You can look up Braden scale online. There's all kinds of pictures and printable PDFs and stuff to download if you want to use that for your client. So then we have skin assessment. So you want to make sure that you're checking all of those areas where pressure is common. You want to, you know, get a good look with the lights on so that you can tell right away if there's any color change or discoloration. You want to check if their skin is hot, where those pressure points are. Is there any swelling in the area? And is there moisture? Because we want to make sure, you know, that we're not letting people sit in a moist depends, or, you know, even sweat can cause moisture damage to the skin. So you want to check for those things. And that way, you know that if you need to do something to try and reduce that moisture, and we'll talk a little bit later about some of the options for that. You want to look for reddened skin. That's going to be usually your first sign. And if the skin is red, you want to check for blanching. And what blanching is, and I'm sure you've all done this probably, you know, to yourself on your arm or whatever, but you know, if you take a finger or two and you press on your arm or your hand or the end of your finger, and you push, you know, pretty hard, and then you let go, underneath where your fingers were is white, right? And then pretty quickly, color comes back to that area. And that's just because your pressure for a few seconds kept blood flow from that little area of skin. And then when you lifted your fingers, the blood came back into the area, making it a normal color. So when you're checking somebody's skin for possible pressure points that are gonna, you know, be at risk for changing into pressure sore, if you see reddened skin, you check to make sure that it blanches. The beginning of a pressure ulcer, or stage 1, is reddened skin that doesn't blanch. So if you push on it with your finger for a few seconds and then lift your finger off, it won't be that lighter color. it's just going to stay that red. And that is a sign of a stage 1 pressure wound. You also want to check for any signs of infection, of course, because any rashes or skin breakdown or any sign of infection, which would be like redness, weepiness, foul odor, those kinds of things. So here's some pictures. The first picture, this is a heel. This person has probably been stuck in bed for a while and had their heel down there. And it's got a pretty significant stage 1 pressure wound. And then the next two are on the sacral area. And I chose both of these to see the contrast or the difference in color when working with someone who has darkly pigmented skin. That what you would call redness can actually look purple. It's not necessarily going to be the bright red like you see on that heel. And then on the right, there's a Caucasian individual who, it's just this pink color. But the key, of course, is if it's not blanching, then you've got a stage 1 pressure wound. So the next risk factor is poor nutrition and hydration. So hydration plays a vital role in the preservation and repair of skin integrity. Adequate fluid intake is necessary to support the blood flow to wounded tissues and to prevent additional breakdown of the skin. Individuals who have pressure ulcers may have additional fluid requirements since fluid can be lost because of the wound draining. And individuals who use pressure relieving air mattresses are prone to excessive sweating, because those air mattresses are generally plastic. And so if they're sweating a lot, they may need extra fluid to compensate for that fluid loss. So for more information on hydration and how to keep people hydrated and keep yourself hydrated, you can check out our class on dehydration. It was recorded on January 11th, 2023, and that's on our YouTube channel. Now, lack of adequate nutrition puts an individual at risk for developing pressure injuries. Several health conditions also can contribute, such as heart failure, inflammatory or catabolic states, respiratory disease, dysphagia, and dental malocclusion, or chewing difficulty, and even a decreased sense of smell and taste can lead to being undernourished. And even some medications can cause malnourishment because they inhibit the appetite, and so individuals may not eat adequate calories and nutrients. And although the ideal nutrient intake to encourage wound healing is really unknown, there are increased needs for energy, protein, zinc, vitamins A, C, and E, and amino acids such as arginine and glutamine. So according to the NIH, high protein oral nutritional supplements like things like Boost or Ensure, or even concentrated protein supplements that are available by prescription are pretty effective in reducing the incidence of pressure ulcers by like 25% in patients who are at risk. So, if you have somebody who is at risk, or they've had a wound, or they have a wound, talk to their doctor about getting them on some high protein nutritional supplements. Proteins are the most important macronutrients since protein is required for the repair of tissues. In one study, a group receiving higher daily protein demonstrated nearly double the rate of healing than those who had lower protein intake. So that's pretty significant, like to heal twice as fast. Wound healing needs energy for collagen synthesis. And so you want to prevent protein energy malnutrition and improve the wound healing, which means the diet should be adequate in energy in the form of carbohydrates and fats and protein. I would say that anyone who's at risk of a pressure injury or who has a pressure injury should be evaluated by a dietitian so that an appropriate dietary plan and supplements can be provided to them. So just one slide that I stole from our previous PowerPoint, and it's just, you know, how do you stay hydrated? Like, what is the real amount of fluids or water that people need to drink in a day? You'd be surprised, it's actually ½ ounce of fluid per pound of body weight. So a 150-pound individual needs to drink 75 ounces per day, which is 4.5 16-ounce bottles of water. Eating plenty of fruits and vegetables that are high in water content can help. If someone's, you know, feeling hungry, drink some water. It goes down easier if you're hungry. And, you know, that's one way to get your water intake up. Drinking during and before meals. Always drink fluids before, during, and after exercise. And increase that amount if they're going to be out in the sun or out in the heat for a long time. And then avoid caffeinated beverages, because coffee, tea, soda, energy drinks, caffeine actually causes you to urinate more, and it works as like a diuretic and will actually make you less hydrated. So avoiding those and just increasing those fluids is how we keep people hydrated. All right, next slide. So the next goal on preventing pressure injuries was minimizing moisture on the skin. So weakening of the skin is caused by prolonged exposure to a source of moisture, such as urine, stool, sweat, wound drainage, saliva, or mucus. And additional complicating factors include mechanical factors such as friction and shear, immobility, pressure, irritants contained in the moisture source, or microbial factors. And so when the skin is exposed to excessive amounts of moisture, it'll soften, it swells some, it can become wrinkled, all of which makes the skin more susceptible to damage from one of those other complicating factors that I mentioned. Excessive exposure to moisture also can lead to rashes and fungal infections. So how do we minimize moisture on the skin? We want to keep at-risk areas clean and dry. And there's a lot of different products that can be used to help reduce moisture on the skin, even if somebody is incontinent and wearing a brief or has a leaking wound or something. You just need to do the best you can to keep it clean all the time and dry all the time. You want to minimize that exposure to urine and stool, which stool in particular, if someone has had a bowel movement in their brief and they are left to sit in it for a while, it's very caustic to the skin. It can cause rapid skin breakdown and put somebody at very high risk for wounds. So you want to do check and change of those briefs frequently. And if the individual is not able to tell you when they've gone or when they need to be changed, it's best to be put them on a schedule where like every hour you're checking to see if they need to be changed. Consistent skincare to protect the integrity of the skin with a skin barrier, that includes cleansing, drying, and moisturizing the skin. And then use of a skin protectant is the last piece of that that's going to really keep that moisture from actually coming into contact with the skin directly. If you have someone who has a draining wound and they're getting dressing changes, you want to make sure those dressings have the proper absorbency. They make foam dressings or really thick gauze dressings. So if it's leaking a lot, you want to make sure those are being used so that the skin is not getting this constant exposure under the dressing to that fluid. And then applying a barrier film or skin protectant to the peri-wound skin when appropriate. So a barrier film and a skin protectant, those are different than a skin barrier. They tend to come like on a little tiny, not swab, but like what alcohol pads look like. They also have barrier film or skin protectant that comes in those little packets, and you can just wipe that on the skin and then let it dry, and then go ahead and put their brief back on. So these are some moisture barrier products that I thought I would share. There's actually a lot of different barrier creams. Those are the ones up in the right-hand corner here at the top. That's a 3M product. It's pricey, but it works very, very well. The one down here on the bottom left is a skin protectant that you can pick up at Walmart for pretty cheap. So they come in a variety of brands. Some are more like an ointment, some are more like a cream. But what's really cool too are some of these other products. So if you have someone who is wearing an incontinence brief and has struggled with protecting their skin, maybe they are prone to rashes or sores due to that moisture exposure, you can purchase these, like this Live Dry Flow Through Design absorbency, rectangle here. It just goes right inside of the brief. It absorbs some of the urine to which their brief will actually last longer. But more than that, what it does is it wicks the moisture away from the skin. So it's like a barrier in itself, right? So, using that can really help keep someone dry, especially if they're, an individual who tends to be incontinent frequently. Something like that can be very helpful. This wrap in the middle, I don't know why I don't have the brand name on there, but I guess it doesn't matter. I think there's multiple brands, but this is really cool. It also goes underneath an incontinence brief. But what it does is you just wrap it around the penis, and it basically catches the urine in that little piece and keeps the urine away from this person's back and their sacral area. So, you're really keeping all that moisture in the front, and that's going to really help to prevent ulcers, but also especially if they have an ulcer already, this is really going to help keep that ulcer from getting worse. and hopefully allow it to heal. Now these interdry sheets up here in the top middle, these are really neat. These ones actually have antimicrobial silver in them. But these are like, they're just a sheet of like a fabric type material. And so remember last time we talked about developing rashes like under an individual's belly and in those creases or under the breasts. You just take the sheet and you just kind of tuck it up in there, and it helps absorb all that sweat and moisture under there, and it helps prevent them from having skin breakdown. And then this particular brand that has the antimicrobial silver in it is going to help keep them from getting an infection and help that skin heal if they've already got some breakdown. Okay, so the next thing we are going to talk about here is frequent bed positioning and bed supports. So when somebody is in bed most of the time, it is really important that you're repositioning them at least every 2 hours. Now, some folks can reposition themselves, right? And you can just remind them every 2 hours, you need to roll on your other side, or time to roll on your back, whatever the case may be. But you want to make sure when you're doing the repositioning that you're not causing friction and shear. And that's why it's really super beneficial if you have 2 staff able to help with repositioning, especially for someone who cannot help you at all, right? The client, I mean. But there are ways to use products, like a draw sheet, or even a incontinence pad that goes on the bed like they use in the hospital, having that to be able to lift the person a little bit and then move them over. That's going to prevent that shearing effect of, like, if you just kind of like slide them over on the bed, you're going to get friction and shear from doing that. So it's really nice when you have 2 people, because one person can be on each side of the bed. You can lift people up in bed and turn them and stuff without dragging them on the bed. And you want to be sure you're using cushioning supports to ease those pressure points. You can see here, they're just using pillows. They have pillow in the top picture between the knees, because those knee bones are really hard right there, and they actually, hit each other and can cause pressure ulcers on both knees because of that pressure. Excuse me. Had to have some water. But if you're working with people who have cerebral palsy, quite often, they're real tight, and they may have their knees just pressed together pretty tight. And it's really important to put some kind of cushion in there. If you can't get a pillow in there, even just using a foam dressing on those knees to try and keep them from pushing on each other. And then you want to check those pressure points for redness and pay attention to those areas. And when you're repositioning a person, that's generally the time to do that. Okay, let's talk about bed support surfaces. So these are kind of from the most to the least, right? Kind of, these top 3. So a pressure relief mattress is generally used on a hospital bed. They're made to go on the bed. They provide support for the head and body. and they redistribute the person's weight, which reduces the amount of pressure applied to any single area of the body. They also reduce friction and shear. Now, air or foam or gel mattresses are lower tech mattresses. And these are the mattress overlays. They don't provide adjustable pressure the way a pressure relief mattress does. And pressure adjusted high-tech mattresses can be inflated or deflated to adjust the pressure, but it's not really the same, right? You'd have to be there, reassessing all the time where the pressure is to get it right. These come in a low air loss or alternating pressure and a combination of those. And some come with a heel slope to prevent pressure sores on the heels. So those are the different types of pressure relief mattresses. Mattress overlays are less effective, but they still may prevent pressure ulcers and aid in healing stage 1 and 2 pressure injuries. Quality overlays are made of a material that doesn't cause heat and therefore sweating. And then many manufacturers make a pressure point relief mattress that goes on a standard bed frame. These might be a good option for someone who has mild risk of pressure injury. So they need something, that's going to provide some relief, but they're not necessarily needing to be on a hospital bed with a pressure relief mattress. And then you have wedges, pillows, cushions, and you're using those so that, when you move the individual to reposition them, they are holding that person in that position. So they don't just like roll right back where they were, and that's going to give them that relief on those pressure points that they were on. But then also to, protect, like I was talking about with the knees, ankle bones, and even, a pillow between the arms can be helpful too. Heel and elbow protectors can be used to prevent sores in those areas. And to reduce friction and shear, caregivers should really be using draw sheets, slide sheets, or positioning pads with handles. Those are pricey, but they're really nice. They're kind of a slick, thin material, and when you're repositioning, the staff can just grab the handles, and it's a lot easier. So, if you've got folks who you're repositioning often, especially if they are on the heavier side, purchasing something like that is great. And you'll not only be helping the client, but you'll also be hopefully reducing the risk of your staff hurting their back or something. So let's see, let's go to the next one. Okay, so this is a slide where I just wanted to show you kind of what I'm talking about, right? So on the upper left, you've got the pressure relief mattress. Sometimes people just call it an air mattress, but it's actually, it's got a motor here that you can see hooked onto the end of the bed. And then inside of that mattress are these tubes of air. And usually these are going to adjust the pressure of air in the mattress based on, the weight of the individual and how they're laying. And it may even like alternate higher and lower pressures so that they're not just getting that constant same pressure from laying there. And below that, that's a pressure relief overlay. they've got it on a hospital mattress here, but I would imagine that you could probably put that on like a regular twin mattress if somebody was not yet utilizing a hospital bed. But you can see, I mean, it's just an inflated mattress topper, essentially. The mattress in the middle, that is the pressure point relief mattress. Yeah, it's just like a regular old mattress, right? But they actually advertise the product as a pressure point relief mattress. It's got, you know, like a nice pillow top with memory foam and all that. Probably pretty pricey, and I do not believe insurance is going to cover that. But insurance will, if they're high risk or have a wound, they will cover a hospital bed with an air mattress on it. And then down in the bottom right corner, this is just a top mattress topper overlay, kind of the old egg crate kind that can just relieve some pressure. They're fairly inexpensive and a good option if you don't have anything else and you're just trying to give some pressure relief, you know, either till you get a prescription for something better, or, you know, maybe their risk is not real high and you can get by with that for a while. Again, positioning aids for bed, some pictures here. In this drawing here, you can see down at the bottom right, that is a drawing of this individual's pelvis and then their hip bones off to the side. And what they're showing you here is that essentially they're not like laying straight up on their side, they're not on their back. And by having them at this 30-degree angle, which they can stay in that position because they're utilizing a wedge behind the back, this actually takes the pressure off the sacrum and tailbone, takes the pressure off the hip, and most of their weight in that area is on the thicker part of the gluteus, which is going to reduce the risk of getting a pressure sore. And then they have the pillow between the knees, but there's also like this product, which kind of straps on one leg, and it's a little spacer to keep the knees apart. And then here's some pictures of pressure relief for heels. You can do this lots of ways. You don't have to get something fancy. You know, there's some pretty nice products. I kind of like this one up here with the that lifts the legs up as well and elevates them. That's probably really nice for somebody who might have swelling in their legs. But you can see if you've got it in the right position, the heels are kind of in this crack, so they're not getting pressure. You can buy little boots like these foam ones that strap on, and even this ankle one, it just lifts the heel right off the bed, so you have space between the heel and the mattress. But a tube-shaped pillow under the ankles is can work as well. So, and then I went ahead and added this one because it's got the Sherpa, you know, fleece lined. It's all warm and cozy, and most people like the way those feel when they're on. So, you know, it's just another option. But there's lots of stuff out there on the market. Excuse me. So then we have pressure relief for elbows. And so these come in a variety of types. Up here on the left, you see the ones that are just the egg crate foam with some Velcro on it. Pretty simple, probably very inexpensive. These sock type ones are kind of cool. And then, you know, they get kind of fancier with these. Here it shows this individual's arm sitting in the wheelchair, and we just trying to get that pressure off that elbow bone that's right there and generally resting on the chair. And this chair has what looks like hard arms on it. So that's why some people choose to purchase, something like these fleece protectors that you actually wrap around the arms of the wheelchair to make the arms softer. Or there's these really fancy ones that have gel in them, and they attach to the wheelchair and really cushion the whole forearm and the hand. This is just another example. So people who use wheelchairs need to be consistently repositioned every 15 minutes. And you're probably thinking, well, what do you mean repositioned, right? Because they're sitting in a chair, like how much repositioning can you do? Basically, they should be shifting their weight from like one butt cheek to the other. They should be just, every 15 minutes or so, you can remind them like, okay, time to shift your weight. Or, you may need to help them. Placing one of those pads that are used on a bed, generally on the wheelchair, can help caregivers lift and then shift the individual so that their weight isn't on the same spot continuously. Or if the person in the wheelchair can support themselves, some of their weight themselves, they can put their arms on the arms of the wheelchair, and you can help them shift while they lift up just a little bit. And doing that is going to help reduce friction and shear, right? So we're not like just dragging their hips over and causing that shearing effect. It's a good plan to implement a repositioning schedule, or have, maybe also have the person get out of the chair for a while when possible. It's individuals who sit in their wheelchairs for many hours every day, they are bound to get pressure ulcers. So it's just really important to know that, because I think most of us associate pressure ulcers with laying and being stuck in bed, but people who use wheelchairs get them too, fairly often, actually. You can use softer seating, and that, I think everybody should have a really great cushion on their wheelchair. It's going to alleviate pressure. You can even have custom wheelchair cushions made that fit the individual's body shape and posture. Another way to relieve pressure is to put their feet on the ground, as like if they're normally up in the leg supports. If you take those away and just like set their feet down, it actually changes the pressure on their pelvic bone just enough to maybe provide a little bit of relief. So, and then trying pressure mapping is cool. That's where a seat cushion, they utilize sensors to deliver a continuous information on the affected area of their where their seat is, and the cushions are made to be the right pressure in the spots where they tend to have pressure from sitting in the chair. These cushions are helpful for healthcare professionals and persons in wheelchairs alike, as they can help them make informed decisions to reduce pressure ulcers or stop them from appearing. So, and then wheelchair support surfaces. Again, wheelchair cushions that alleviate pressure, custom wheelchair cushions. using pressure mapping. It's almost like biofeedback, right? You can see where your pressure is, so you know how you need to move to alleviate it. But they even make alternating pressure cushions, which is kind of like a pressure relief mattress, but in a wheelchair cushion, which is pretty cool. The most important considerations, though, are going to be the cushion shape and the cushion material. Some people like saddle-shaped wheelchair cushions, or there's pommel-shaped wheelchair cushions and wedge-shaped wheelchair cushions, and then anti-thrust wheelchair cushions. So I learned a lot about wheelchair cushions when I was researching for this class. The three most common or popular cushion materials are foam, gel, and air. And the materials that the wheelchair cushion is made of can have an impact on the person's comfort and their experiences. Because of course, you know, you want something that's not gonna be causing them harm, but also it can affect how they feel, if they're comfortable in their chair or not. If they're not comfortable, they're not going to be real happy. So it's really important that cushions are specific to the client and is suited to their mobility and positioning needs. Custom wheelchair cushions are made specifically to match that person's unique shape and help decrease long-term skin risk, while aiding in sitting stability for improved function. Some seat cushions feature the pressure mapping technology. These cushions are helpful because they can use it in that almost like biofeedback way. But other than the cushion, heel protectors and elbow protectors are probably, you know, the biggest thing as far as preventing those pressure wounds. And I would think, you know, depending on the chair, if it's got a cushion back on it, maybe using a pillow or something behind their back to alleviate that pressure on the scapula. So this is a cool picture of the pressure mapping technology. And what you can see is, first of all, that the person in the top picture is kind of like slid out a little bit in their chair, right? And I think we see this all the time in people who are in wheelchairs, because maybe they don't have the upper extremity strength to like put their arms on the arm of the chair and lift their butt back where it's supposed to go. And so they slide forward and then they get stuck there. And then there's this pressure on that coccyx and tailbone that can cause a pressure wound. And you can see too, the shape of the back, there's a green arrow there and it's showing you that, you know, their back is curved and kind of slouched, sitting there. On the left-hand side, you can see the red, and I like the 3D image. You know, it's just these two really high points of pressure right there on the pelvis, and I guess those are your hip bones under there. And then the one on the bottom shows with a special cushion that is designed. You can see this seating cushion has a curve to it. And that little bit of curve up in the front is keeping them from sliding forward, sliding down. They have a cushion on their back to protect that scapular area. And on the pressure mapping screen to the left, you can see that we no longer have those really high points of pressure. Where you do see more pressure in that picture is actually in the front, where the cushion itself appears to be applying a little bit of pressure. I think that's where that is. But overall, you're looking at all just blue, green, and yellow there. So not those bright red points of extreme pressure. So all of these things, can be utilized to help prevent pressure injuries. And if someone actually has a pressure wound or has had a significant pressure wound in the past, all of these things really need to be used. Tissue for pressure injuries of the past, it never ever heals back to its normal state and function. And so, they're always going to be at a high risk for that area to open up again. So we just need to do the best that we can to keep our folks safe and healthy. Okay, does anybody have any questions? I'm going to look at the chat. I'm so sorry. I didn't even look at the chat. I said I was going to though. Okay, I didn't miss anything. All right. Well, if anybody thinks of a question, or maybe you have a case